When you hear crooked legs, well, you might picture an animal that's just a bit clumsy,
Yeah.
maybe. But beneath that seemingly straightforward image lies a surprisingly complex veterinary challenge.
It really does.
Today, we're taking a deep dive into angular limb deformities, or
Hmm.
ALDs, and we're focusing on two animal groups you might not immediately think of.
Hmm.
Camelids,
Hmm.
like llamas and alpacas, and cervids, deer and elk.
Fascinating groups for this topic.
Exactly. So our mission in this deep dive is, well, to give you a shortcut to understanding this pretty intricate problem, we'll reveal some surprising facts about how these deformities pop up, how they're diagnosed, and what it really takes to treat them.
And you'll discover why similar-looking issues in, say, a llama versus a deer can tell completely different biological stories.
That's the core of it.
Yeah, so angular limb deformities. They're essentially deviations in the alignment of an animal's limb bones. They represent a significant orthopedic challenge,
Yeah.
especially for very young, large animals,
Why young ones specifically?
because they can seriously impact their ability to move, their overall growth, and, their long-term health down the line. It's a condition that really demands a nuanced understanding.
Okay, let's unpack this then. So what exactly are angular limb deformities at their
Well,
core?
Okay, so at their core, they describe a limb that deviates from its normal straight alignment. It creates what we visually recognize as a crooked leg.
Right, the visual cue.
And that misalignment, it can lead to pain, lameness, and over time, pretty significant joint damage.
Got it. So how do you categorize these? Are there specific types?
Yes, absolutely. To be precise, we classify these deviations into two main types. A valgus deformity means that the limb deviates outward from the body's midline.
Outward, like knock-kneed.
Exactly, appearing X-shaped or knock-kneed in the limb segment below the affected joint. This is really common at the carpus, which is basically the knee,
Okay.
and the tarsus, or the hock.
Right.
Then on the other hand, you have a varus deformity. That's an inward deviation. The limb bows inward.
So bow leg.
That's the classic bow-legged conformation, when the limb bends towards the body. You can also see rotational deformities where the limb actually twists along its long axis, often alongside the valgus or varus.
Oh, and you name it based on the joint.
Always. We name the deformity by the joint affected, so you'd hear terms like carpal valgus, meaning an outward bend at the carpus.
Okay.
What's interesting here is that while any joint can be affected, the carpus, tarsus, and fetlock are definitely the most common sites.
Right.
And here's something important for you to know. A mild carpal valgus, we're talking less than 5 degrees, can actually be pretty normal in holes.
Oh, really? It fixes itself.
Often, yes, it self-corrects as they grow. But any degree of varus deformity, that inward bowing, is generally considered abnormal and definitely needs a closer look.
That's a really clear distinction. Thank you. So we've identified what they look like, but what's happening at the fundamental biological level?
Yeah.
What causes a limb to become crooked? Where's the root of the problem?
That is the key question. The biological epicenter for most of these deformities is the physis.
The growth plate.
Exactly, the growth plate. This is the spot where bone lengthening happens in young, growing animals. The core issue with ALDs is that one side of that growth plate starts growing at a different rate than the other side.
Asynchronous growth.
Precisely. When this asynchronous growth happens, the limb invariably bends towards the side that's growing more slowly.
Okay, makes sense.
And this asynchronous growth, it has a crucial window of opportunity for us to intervene. Things like trauma or other insults can damage the chondrocytes. Those are the cartilage cells doing the work on one side of the physis.
Damaging the cells.
Yeah, and that effectively tethers that side's growth. It slows it down. There's actually a principle, the Hütter-Volkmann law, that explains this beautifully.
Oh, what's that?
It basically says that compression inhibits physial growth while tension stimulates it.
So pressure slows growth, pulling speeds it up.
In simple terms, yes. And this principle is why the timing of intervention is so vital. We're essentially working with the bone's natural response to pressure to guide its growth back to straight.
Right.
But what's absolutely critical to remember is that each growth plate has a finite period of activity. It closes, it stops growing at a genetically predetermined time.
And it's not the same everywhere.
Not at all. This timeline isn't uniform across the body. The physis down low, like at the fetlock, have a very short, rapid growth phase. They close much, much earlier than those higher ups, like at the carpus or knee.
Wow. Okay, so that changes everything for treatment.
Completely. It means the urgency and the type of treatment depend not just on how severe the bend is, but on its precise anatomical location.
So, like, a fetlock problem is more urgent.
Much more. A fetlock deformity in a very young animal is practically an emergency because that growth plate closes so early. You have a far, far smaller window to intervene compared to, say, a carpal one.
So it sounds like figuring out the root cause is almost like detective work. It's not always as simple as the leg is crooked, is it?
Exactly right. You have to dig deeper.
So what are the broad categories of causes we generally see here?
Broadly, they fall into two buckets. Congenital, meaning they're present right at birth,
Okay.
or acquired, meaning they develop sometime after birth.
Can you give examples?
Sure. For congenital, you might see something like ligamentous laxity, loose ligaments. Often, the limb can be manually straightened by an examiner, which usually means a better prognosis.
That sounds less severe.
It often is. Another congenital cause, though, is incomplete ossification of the cuboidal bones. These are the small, cube-shaped bones in the knee or hock. If they're still mostly soft cartilage at birth, well, they can get crushed under the animal's weight.
Oh, that sounds bad.
It leads to a much poorer prognosis, unfortunately. And sometimes just how the fetus was positioned in the uterus can cause a congenital deformity.
And acquired. Things that happen after birth.
Acquired ALDs can result from, say, direct trauma to the growth plate, a knock or injury. Nutritional imbalances are a big one we'll talk more about, or even just excessive or uneven loading on the limbs as the animal grows.
Okay, that gives us a good framework. Now let's turn to our specific animal groups, starting with those New World camelids, llamas, and alpacas.
Right.
And here's where the story takes a really fascinating turn, apparently. The overwhelming primary cause of ALD in these animals, it points directly to a specific metabolic bone disease.
That's exactly right. It makes it, in many ways, kind of a man-made problem, or at least husbandry-related.
Wow. Okay, what is it?
The primary culprit is hypophosphatemic rickets, secondary to vitamin D deficiency.
Rickets. Like in old history books.
Sort of, yes, but the mechanism here is specific. The reason camelids are so susceptible is actually unique to them. They evolved way up high altitude equatorial regions.
And that's the sun then.
Intense solar radiation, exactly. So when we raise them in temperate latitudes, especially in the northern hemisphere, think about Chris, the babies, born in the fall or winter, maybe January through March.
Less sun, darker days.
Precisely. They simply lack sufficient UV radiation exposure for their skin to synthesize adequate vitamin D. And if they have that really dense fiber...
Like alpacas often do.
Yeah, it makes it even worse. It physically blocks the little UV light that is available from reaching the skin.
So what's actually happening inside the body then?
Oh.
Because of the low vitamin D?
Well, when vitamin D is low, these animals can't properly absorb calcium and phosphorus from their diet. And those minerals are crucial for building strong bone.
Right.
So this leads to impaired bone mineralization, especially right at the growth plates. They become weak, disorganized, and can't handle the stress of growth and weight bearing.
And that causes the bending.
That's the main mechanism. And the clinical signs aren't just crooked limbs, though that's obvious. You also see stunted growth. They might be lethargic, have a decreased appetite, and often a characteristic hunched back posture because of skeletal pain.
Ouch. And is there a typical look to the crookedness in camelids?
There often is. The most common presentation is a bilateral carpal valgus.
Bilateral, both legs. Carpal valgus. Outward at the knees.
Exactly. Both forelimbs deviating outwards at the knees. It's quite characteristic.
How do you confirm it's rickets?
Diagnosis is pretty definitive with radiography x-rays. They show distinct patterns like flaring or widening at the ends of the bones near the growth plate, irregular growth lines,
Okay.
and a broadening of the growth plate itself, what we call physeal ectasia. This is often most obvious in the ulna, one of the forearm bones. In fact, the ulna is frequently the primary problem, and the radius, the bigger forearm bone, deforms secondarily because of it.
Interesting detail.
But most importantly, diagnosis isn't just x-rays. A mandatory biochemical analysis blood work is key.
Checking the vitamin D levels.
Exactly. It reveals low serum vitamin D and, crucially, low phosphorus. That confirms the metabolic basis of the disease. It is hypophosphatemic rickets.
That environmental link for camelids is really striking, isn't it? Such a direct consequence of moving them out of their native environment.
It really underscores how critical understanding a species' evolutionary background is for proper husbandry.
So, given that understanding that it's largely vitamin D deficiency, what are the primary avenues for treatment in camelids? How do we fix this?
Well, for camelids, the treatment is definitely multifaceted, but the cornerstone, especially for rickets-induced ALD, is conservative management.
Meaning?
Meaning nutritional supplementation is absolutely critical. Giving them vitamin D, often through injections initially, allows for spontaneous correction, particularly in young crayas.
So just giving them the vitamin can straighten the legs.
In many cases, yes, especially if caught early. It's quite remarkable, actually, how quickly they can respond. Sometimes you see improvement within weeks once their dietary needs, specifically vitamin D and phosphorus, are met.
Yeah.
We also usually recommend controlled exercise, not too much, not too little. And sometimes splints or casts can be used for temporary support, especially if the deformity is severe or there's ligament laxity too.
Okay, so nutrition first. What if that's not enough, or the animal is older?
Right. Then surgical intervention becomes the option. It's reserved for more severe cases or those that don't respond to nutritional management or in older animals where the growth plates have less potential left.
What kind of surgeries?
There are a few main types. One is periosteosteal stripping, sometimes called HCPTE. This involves making an incision in the periosteum, the membrane covering the bone, on the concave side, the short side of the bed.
And that does what?
It's thought to release tension and accelerate growth on that slower growing side. It's best for mild deformities in very young crias, usually less than 3 months old.
Okay, a subtle boost.
Exactly. Then there's a more powerful technique called transfascial bridging, or TPB. Here, we actually retard growth on the convex side, the side that's growing too fast. Usually using implants like screws and wires or small plates placed across the growth plate on that faster growing side. This slows it down, allowing the other side to catch up.
That sounds effective, but tricky.
It is. And a really critical point here is that these implants must be removed promptly once the leg is straight. If you leave them in too long, you risk overcorrection. The leg starts bending the other way.
Yikes. Need good follow-up.
Absolutely crucial. Then finally, there's corrective osteotomy, or CO. This is more of a salvage procedure.
Salvage.
Yeah, for older animals where the growth plates have already closed or the deformity is just too severe for growth modulation, it involves actually cutting the bone, realigning it into a straight position, and fixing it with plates and screws.
That sounds major.
It is much more invasive, requires general anesthesia, and has a significantly longer recovery period.
But what's the general outlook, the prognosis?
It really varies. Mild cases caught early and treated with vitamin D have a good to excellent prognosis. More severe cases, or those needing surgery, especially TPB in very young animals, the prognosis might be more guarded.
Why guarded if they do surgery?
Often because needing surgery that young indicates a really profound underlying issue with the growth plate quality itself due to severe rickets. So even with surgery, they might have lingering issues or develop arthritis later.
Got it. Okay, let's switch gears now to cervids, deer, and elk.
Right.
Here you said the story takes a profoundly different turn. We might see similar-looking crooked legs, but the underlying cause is fundamentally different, especially in farmed populations.
That's the key point. It really paints a picture of the potential cost of rapid growth in managed populations.
Okay, so what is the primary cause in farm cervids?
In farm cervids, the primary cause is overwhelmingly considered to be physeal osteochondrosis.
Osteochondrosis. That sounds different from rickets.
It is completely different. The key distinction here is that osteochondrosis is a failure of cartilage maturation at the growth plate. It's a problem with how the cartilage cells develop and turn into bone. It's not a mineralization failure like rickets.
How do you know it's not rickets?
Well, crucially, serum calcium and phosphorus levels in these affected deer and elk are typically normal. That immediately helps rule out rickets or a similar metabolic bone disease.
Ah, okay. So who gets this osteochondrosis?
It occurs with notable frequency in what they call rising 2-year-old stags, so males, around 18 months to 2 years old. This is a period of extremely rapid growth for them.
And it's linked to farming.
Yes, it's generally considered an iatrogenic or production-associated disease. Something about how we manage them contributes to it.
What's the theory?
The main hypothesis is that intensive management practices, especially feeding high-energy diets designed to push for rapid weight gain and particularly big antler growth, the velvet production.
Right, that's economically important.
Exactly. But that push for rapid growth might simply overwhelm the growth plate's capacity to mature properly. The cartilage development just can't keep up with the speed of growth being demanded.
Interesting. And does it look different? You mentioned camelids often have carpal valgus, outward. What about deer?
That's another key difference. The most common presentation we see in these farmed cervids is bilateral carpal varus.
Varus, inward bowing, the opposite.
The exact opposite direction to what's typical in camelids with rickets. Both front legs bowing inward at the carpus.
Why the difference?
It likely implies a different biomechanical stress pattern or a fundamentally different pathological process happening at that growth plate compared to rickets.
And diagnosis, still x-rays.
Diagnosis relies heavily on a good physical examination to pinpoint the pivot point of the deformity, and yes, radiography is key. X-rays confirm the location and severity and identify signs specific to osteochondrosis, like physial thickening or irregularity, maybe some fragmentation.
That's a really significant difference between the two groups. Now, we've discussed farm cervids, but what about their wild counterparts? Do we see similar issues in wild deer and elk populations, or is that a different story entirely? That's a critical question, and honestly, the sources reveal a really striking absence of data on significant ALDs in wild populations.
An absence of data, so
yeah,
it just doesn't happen much.
That's the strong implication. This profound absence points towards a strong negative selective pressure in the wild.
Meaning nature weeds it out.
Exactly. Think about it. A significant ALD, whether varus or valgus, would inevitably lead to painful lameness and early onset osteoarthritis in a wild animal.
Yeah, that wouldn't be good.
Imagine the dire challenges a lame wild cervid would face. It would be severely hampered in evading predators.
Easy target.
Right. It would struggle to forage effectively or migrate with the herd to find food and water. And its reproduction would be severely compromised.
How so? Well, male deer or elk, for example, couldn't possibly compete effectively in the rut the breeding season fights. An abnormal limb conformation might even affect antler development, which is crucial for mate selection. Females would struggle to carry pregnancies or raise young.
So they likely wouldn't survive long or pass on the genes.
That's the conclusion. Such an animal would almost certainly be removed from the population, either by predation or starvation, long before reaching maturity or having a chance to reproduce. This natural selection keeps the incidence incredibly low.
Which really highlights how human management practices in farming can, well, create conditions or allow conditions to persist that simply wouldn't exist in the wild.
Precisely. We remove those selective pressures and sometimes inadvertently create new pressures, like the push for extreme growth rates.
This comparison is incredibly insightful. It really puts the farmed animal situation into perspective. So, pulling this all together, what does it really mean for managing these animals day to day?
Well, let's summarize the key contrasts again, because they dictate the management. In camelids, ALD is primarily a systemic metabolic disease. It's rickets, stemming from vitamin D deficiency. So it's fundamentally a preventable husbandry-related problem.
And it usually looks like.
Often presents as bilateral carpal valgus outward knees.
Right. And farmed cervids.
In farmed cervids, ALD is typically a focal developmental orthopedic disease. It's osteochondrosis. It seems directly linked to intensive production practices, that rapid growth push.
And looks like.
Often presents as bilateral carpal varus inward bowing knees.
Okay, so completely different root causes and even different presentations. This gives us some really actionable implications for owners and managers then.
Absolutely.
For camelid owners, it sounds like proactive vitamin D supplementation isn't just a good idea, it's almost a non-negotiable standard of care, especially for those fall or winter babies.
I would strongly agree. It should be standard practice in non-equatorial regions. Plus, early screening, just looking closely at chlaria legs and prompt veterinary consultation if anything looks off. That includes getting blood work and potentially radiographs.
And maybe thinking about breeding too.
Yes, definitely advise against propagating animals with poor conformation, although in this case it's often environmental, not purely genetic, but good conformation is always a plus.
Okay. And for farmed cervid managers, what's the take-home there?
For farmed cervids, the recommendation really leans towards a shift in philosophy. Maybe moving away from maximizing growth rates at all costs towards optimizing them through more balanced nutrition.
So not pushing them quite so hard so fast.
Essentially, yes. It also means paying close attention to comprehensive mineral management, not just calcium and phosphorus, but trace minerals like copper and zinc, which are vital for healthy cartilage and bone development.
And keeping a close eye out.
Vigilant monitoring for any early signs of limb deviation is crucial. And frankly, a critical evaluation of the economic benefits versus the animal welfare trade-offs inherent in really intensive production systems.
That's a tough balance sometimes.
It can be, but understanding the biological cost helps inform those decisions.
And where do veterinarians fit into all this?
Well, for vets, it really underscores the need for a systematic, species-specific approach.
Yeah.
You can't treat a llama's crooked leg the same way you'd treat a deer's.
Right.
And client education is huge, especially explaining that critical window of opportunity for manipulating physical growth, why acting early is so important if surgery is considered.
Definitely. So reflecting on this whole deep dive, what really sticks with you? What's the big picture?
For me, it's how a seemingly simple physical sign, a crooked leg, can be a symptom of vastly different underlying biological dramas.
Yeah.
One driven by environment and metabolism, like the Camelids story.
Yeah.
The other by developmental pressures, possibly linked to our own agricultural practices, like in the Cervids. It's fascinating how genetics, environment, and human influence all intersect.
It really is.
And our understanding of these conditions, it continues to evolve. Which leads to maybe a provocative thought to leave with.
Okay, let's hear it.
As humans increasingly manage and interact with animal populations, whether it's on farms, in zoos, or even through conservation efforts for wild species, what broader responsibilities do we have? Responsibilities to truly understand their unique biological needs, their evolutionary context, and the potential for our actions to have unintended consequences on their health and development. How might adapting our practices, rather than constantly pushing animals to adapt to ours, lead to healthier, maybe more sustainable outcomes for all species involved?
That's a really powerful question to ponder. Thinking about how we adapt to them, not just the other way around.
Something to think about.
Absolutely. Well, thank you for joining us on this deep dive. Keep learning, keep questioning, and we'll be here to unpack more fascinating topics for you soon.